The majority of babies will use a pacifier to some extent during their childhood. However, newer biomechanical models are showing that most pacifiers are inappropriately sized for the children, causing undesirable forces during a key time of facial growth. Typically, when pacifiers do come in different sizes, they're based off of chronological age, but chronological age is not a size metric. Recent advancements in facial anthropometrics and AI now make it possible to prescribe a pacifier that best correlates with a child's early oral facial growth. My colleagues, Dr. David Tassini, Dr. Clive Friedman, Aditha Kethu, and myself, Dr. Kris Hendricks, would like to invite you to read our newly published article, Pacifier Sizing as a Prescription for Better Oral Health Outcomes for Infants, a Call to Action. Babies are born with a reflexive drive to suck, and this suck, swallow, breathe movement is essential for the development of the craniofacial respiratory complex. However, for many children, the desire to suck is not met by feeding alone and is also used for comfort, and therefore many children will develop non-nutritive sucking habits. Pacifiers are often used to meet the non-nutritive sucking desires of children. However, their introduction interferes with the normal forces involved in the craniofacial respiratory complex development. Pacifier companies often ignore the way their products interact with the growth of a child, or they make poorly substantiated claims to the way their pacifier may support oral development. Modern biomechanical engineering models now allow us to use finite element analysis to see the stress distribution of different pacifiers upon oral facial structures. With these analyses, we have a much better understanding of how pacifier bulb size, shape, and even shield design affect the growth and development of craniofacial structures. What we're learning is that most pacifiers are actually too small to support oral development. When pacifiers do come in larger sizes, they're typically delineated by chronological age. But again, chronologic age is not a size metric. For this paper, we found a complete lack of consistency and conformity between the different manufacturers for recommendations for size. The future of pacifier design lies in leveraging advanced engineering tools, anthropometric data, and facial biometrics to guide sizing and design. For example, smartphone apps can now utilize this data combined with that data of a child and predict which size-shaped pacifiers would best support the oral development for an individual. Our conclusions and call to action are the following. Pacifiers must be recognized as affecting the development of the craniofacial respiratory complex and therefore having long-reaching downstream consequences. The baby industry must adopt modern engineering models to better evaluate the functional aspects of their products. Biometric sizing represents a giant advancement in pediatric oral care. Soon, AI models may not just be able to inform you of the correct size and shape of a pacifier, but also when to move a child to a larger size. And lastly, these technologies must be utilized in further research. We hope you'll take the time to read our article.